Hello, folks. My name is Dustin Jones. Welcome to the PT on Ice Daily Show brought to you by the Institute of Clinical Excellence. Today's Wednesday. That means it's Jerry on Ice, where either myself or Christina Previtt are going to talk about all things older adults. We teach modern management of the older adult, the online 8-week course or the 2-day live course as well. So last week I talked to y'all about the Senior Rehab Project rebranded to Jaros Health, and how we were really taking things to the next level and partnering with ICE to build out a full older adult curriculum to address the needs of the community that wants to better serve older adults. So after that announcement, I had an Oasis Starter Care, a new patient that I had. So in home health, the Starter Care is whichever discipline that goes in to the home first. They have to do this Oasis Starter Care. And I hate it. I absolutely hate doing this document. It takes forever. Lots of pushing buttons and typing, and just it takes a long time. But what I do appreciate about the Oasis Starter Care is that it has really pushed me to think differently about my patients. And more, I would say, think about the person in front of me, the context and the situation that they're in, and not just the back or the knee or the hip per se, like they would come see me for in outpatient orthopedics, for example. But today I want to take the time to talk about a lesson I'm learning from the Oasis Starter Care, and just something that I really want to emphasize with a lot of my patients and just want to share with you all. And that's the concept of triage. We hear a lot about triaging, especially in kind of first responders, emergency services. So to define triage, I'm going to make this very simple, but triage is assigning a degree of urgency to wounds or illnesses to decide the order of treatment of a large number of patients or casualties. Okay? So assigning a degree of urgency to wounds or illnesses to decide the order of treatment of a large number of patients or casualties. And so to give you an example of this, I think back to my days in undergrad as an athletic training student. So I studied athletic training, and it's a pretty intensive program where we were putting in hours upon hours upon hours on the football field, in the clinic or the athletic training room, or on the basketball court, whichever sport that we were with. Well, we had an EMT on faculty, and they would set up scenarios where we would have to respond to some type of accident or emergency in the middle of a lecture. So we would be sitting in class talking about energy systems, for example, and the faculty would have schemed this without the students knowing, and our EMT faculty would bust into the door, freaking out, screaming, oh my gosh, there's 3 people out on the ground on the basketball court. And so we would sprint out of the room, and then we would be placed in a scenario where we had to respond to that emergency, and we had to triage. The first thing that we triaged was who needed our care first. So let's say someone was unconscious and then another person had an open tib-fib fracture, for example. We're going to address the person that is unconscious. Unless there's multiple people, then we'll work that out. But it was scenarios like that, and we kind of went through the treatment and what we would do. But I want to go beyond, just creating, a list of urgency of multiple people. But I want us to really think about a list of urgency of multiple deficits, because that is very common in our work, isn't it? You think about some of the patients that you're going to see today, or have seen today, depending on when you listen to this. But there usually is not one simple issue that is the driver, the cause of of what your patient is suffering from. There's many factors that we have to consider. Often though, when we do consider these factors, when we develop our triage list, especially in the physical therapy world, what does it look like? It commonly looks like, maybe a lack of hip internal rotation, maybe limited ankle dorsiflexion, and maybe glute med weakness. Let's address all 3. I think the ankle dorsiflexion is a bigger issue, so we'll start there. We'll put that at the top of the triage list, and we'll just kind of work our way through. That's kind of how we think often. We just have those specific physical deficits in our triage list. And as a home health PT and doing Oasis Starter Cares all the time, I am forced to think beyond physical deficits and think about the person in front of me. I have to think about the different systems involved. I have to think about their social contextual factors. I have to think about environmental factors. I have to think of their mental health. We're forced to answer questions about all these things that are impacting one's quality of life. that I feel are often missed or just not addressed in many other settings. And so in Jerry PT, when you are working with older adults, we have to acknowledge the medical complexity of the patients that we're working with, and that we may need to triage some of those factors, and they may not be physical therapy related per se, and that was in air quotes. It may not be a physical limitation, but it may be something environmental that may be more of an issue that is getting between the patient and their goals, or the patient and functional independence. So I want to give a couple examples of this that I've come across recently, and just to get you all thinking about your patients and just different ways that you can serve them well, and just to have a bigger picture of how you can make someone's life better and help them achieve their goals and maintain a high functional output and quality of life. So the first one was the Oasis Starter Care that I did last week after that rebrand episode of Jero's Health. So this person, they've had a stroke for I think around 11 years, affecting the right side. They had physical therapy. They went to a rehab hospital, but then they were discharged and didn't have home health. And they've had outpatient maybe a couple times over the span of a decade. And the patient had a functional decline. They went to see the PCP. PCP referred to home health. And so I'm going in, kind of doing the Oasis Starter Care, checking all my boxes, kind of seeing how they're doing with transfers and their environment and whatnot. And as the session progressed, they've got a good system. But it was very clear that the patient's rehab potential is fair. I mean, yes, we can make some improvements, but we're not going to see a significant amount of change in terms of what home health PT is going to do. But what I did see was my ability to impact my patient's quality of life and her spouse's quality of life by focusing some of my interventions on the caregiver. How could I support the caregiver to help with how they're performing the transfers already, to give them some tips on home modifications and how they can change things to make their life a little easier, of maybe working on a deadlift with the caregiver so they can perform that hip hinge movement and handle a lot of load, a lot of external resistance, and be able to transfer efficiently and not have the nagging back pain that they've been having for years. Some of those things that I wouldn't necessarily think of in the outpatient ortho side, but in the home health, it is very clear of the impact that I can make on my patients' lives when I do have that perspective. And it may involve me focusing more on the caregiver than the patient per se, in air quotes. So what I do, I went over the deadlift. I got some kettlebells out. They did some deadlifts and learned that, oh wait, I can lift 35 pounds without pain, and showed them those mechanics. And we practiced that with some sit to stands with the patient. I gave them, I sent them an email later on that day with about 5 Amazon links of different little pieces of equipment that could really make an impact in their life. And that was just a huge difference for them when I came back for the follow-up visit. That impacted the patient's quality of life because she was probably getting up more, transferring more, moving more, and the caregiver was much happier and just very optimistic about his ability to care for his wife going forward. So the caregiver, was pretty high on the triage list. Yes, the patient had contractures. Yes, the patient had right side weakness. Yes, they had multiple gait deficits. But for me to impact their quality of life quickly and in a very impactful manner that I could say was urgent, was to really empower and improve the caregiver's capacity to care for their spouse. So that's the first example. The second example is a patient that I'm seeing that had a hip fracture on the left side, and they're walking with a wheeled walker. And, they have the typical deficits that we would see with a hip fracture, someone that's 10, 11 weeks out. So something that you all are very familiar with, in whatever setting, that my patient is kind of the typical patient. However, my patient, she told me, day 1 or day 2 of her struggle with weight, of, making healthy decisions. And, she has many, chronic lifestyle diseases, a long medication list, and she's relatively young. I would say, she's kind of, mid 70s, and she's worried. She's worried about, what life is going to look like down the road. What's her functional trajectory? She's worried about her hip, but she's worried about her overall health. And in that moment, in my triage list, yes, all of those, typical deficits that we would see, the weakness, the gait instability, the pain, all those things are important and I'm addressing. But what really rose to the top was my ability to try and influence her to change behavior, to push her and nudge her towards a healthier lifestyle. So this is where I put on my Mike Eisenhart or Allie Hartman hat on and really start to thinking, how can I influence someone beyond my home health PT discharge to make some changes in their life and their daily living that can really set them on a positive trajectory going forward, to get them moving more in some type of manner to where they are getting some type of moderate to high intensity activity, to really, get stronger and hopefully improve their overall health and fitness. And so we leveraged a new step. We started doing 10-minute EMOMs, we did about 15 seconds, just all out sprint, and then 45 seconds rest. And they were looking at the wattage to, they were going for like 90 at first, and now they're up to 100. And it's become quite the competition to see, how much power the patient can put out during those intervals. But that has become a daily highlight of her day when we started, I think 6 weeks ago. Every day she is getting moderate to high intensity activity, at least 10 minutes. Before she was maybe walking to the dining hall and back a couple times a day. And she's lost weight already. She's noticing that she feels stronger. She's feeling better. She always feels better after she works out. She's starting to participate in more of the activities in the assisted living facility. And that intervention, even though it was a small part of our plan of care, and probably, some would say I needed to work on her glute med weakness, for example, or really improve her gait pattern first. And I could really make the argument that me getting her to adopt this healthy behavior earlier on in our course of care, that I've really set her up for success going down the road, even beyond discharge. To lose weight, to get some of those health goals that she's mentioned, to really affect her functional trajectory going forward. Now, yes, we're going to address those specific deficits, but I think it's an and not or scenario. And so I think she was a great example. When I looked at the triage list of her overall health and just some of these chronic lifestyle diseases, we really wanted to take the opportunity while she was in my care, as I was seeing her for 3 hours a week, to really kind of nudge her towards health and tried to implement that new step, interval program. And it's working so far. So that's just something that I've been thinking more about, the triage list, thinking beyond those physical deficits and how can I impact people's lives. I think the home health PTs that listen to this, you're just nodding your head. Yeah, I get it, Dustin, I get it. But I think for the outpatient ortho folks, the majority of people that listen to this podcast, whether this is on PT on Ice or whether this is on the Jaro's Health podcast, really think broad when you are working with your older adult patients. It's a very complex situation, whether it's medically complex, socially complex, environmentally complex. Develop that triage list. They may come to you for their back pain, but their back pain may not be the biggest issue. There may be something else, and you may be able to really nudge them forward and help them achieve their goals quickly, and oftentimes, prevent, functional decline down the road. So the triage list, think about it, expand your horizons, think like a home health PT for a little bit, even for you outpatient folk, and let me know how it goes. All right, ptonice.com. I want y'all to go there. Go to the bottom. There's a thing called Hump Day Hustling. You get 5 valuable, helpful links of pertinent research articles or different reads or podcasts that we enjoyed that week from the different faculty. And then you also see the upcoming courses. This has been very valuable for thousands of people. Very short, succinct, quick and dirty, packs a punch, not spammy whatsoever. Every single Wednesday morning. ptonice.com, go to the bottom, sign up for that. You will not regret it. So in 1 week, Christina Previtt's going to hop on the mic. She's got a special announcement about the future of Jaro's Health and the future of Stave Off as well. So I'm not going to give you any more details, but you'll have to listen in for that. Thank y'all for listening. Talk with you soon.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.